And this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is the second Thursday of the month, which means it's time for Vegan Doc Talk with Dr. Scott Harrington. And he's going to talk about how you can soothe the burn, GERD relief through diet and lifestyle. Please welcome him to the show. Hi, Dr. Harrington. How are you?
Yay! Hey, Chef AJ, how you doing? It's good to see you.
I'm great. You know, I made a post recently. I don't know how much you're on social media. I try not to be on it too much myself about plant-based doctors that I felt that it was important for people to have one in their, like in their tool belt, even if they like their doctor, because so much of even the way blood tests are interpreted are so different. And people are like, oh, well, they don't take insurance, but you do, don't you?
Yes, I do. Yes, Aetna, Cigna, Tricare, Medicare.
Wow, I can go to you next year. That's so cool.
That's
Aetna,
awesome.
Aetna, Cigna, Tricare, Medicare. I've heard of Aetna and Cigna. I haven't heard of Tricare, but for sure Medicare. That's amazing.
Yeah, Tricare is the military. Tricare East. Yeah,
Well, and you are military, right?
that's right. That's right. I just did 2 weeks Army Reserve. That's right.
Where did they send you? Can they send you wherever they want?
Yes, yes, but I have a job in Alabama. It's called Fort Novosel. It's a aviation safety. It's medical aspects of Army helicopter flight and medevac and the safety related to those things. So it gives me a chance to do research as well as serve the Army. So I love it.
Well, that's kind of cool. So when you do that, are you able to get plant-based food the 2 weeks that you have to work for the Army?
Oh yeah, I'm pro Army. Army has to provide the USDA guidelines of food. So I mean, they do provide animal products and stuff like this, but they always have a robust salad bar, and they're always offering a lot of vegetable options and stuff like this. And so yeah, I always eat like a king when I'm in the Army.
That's nice. I forget the MREs. Have they ever made them vegan and healthy?
I'm not sure if there is a vegan one. There's vegan options inside of them. The main meal, they always go by the main meal. And I don't know if they have a vegan main meal, but they have vegetarian ones. But you just wouldn't eat the main meal part. You'd have like the crackers and the stuff on the inside. Not super awesome, but the goal is not to be living on the MREs. Those are kind of in a pinch when you're somewhere and there's no support.
That'd be so cool for travel, though, if we could get some that were really tasty and really healthy.
Yeah, absolutely.
And not so high in calorie density. The companies I've seen that do it, it's like a lot of nuts. And it's like, I get it. That's like soldiers need the calories, but some of us people just would like something a little bit less calorically dense. Have you ever been able to like give presentations to the Army about the benefits of a plant-based diet, or not necessarily convince, but have this conversation with any of the officers about how this could really improve the military?
Yeah, well, with veterans groups, I've done that before, and it's been well received. And well, with
Mhm.
veterans, yeah, and there's also like lifestyle. The American College of Lifestyle Medicine has a military working group trying to influence the military about lifestyle medicine and plant-based diet.
That's really cool.
Mhm.
Yeah. Well, I'm interested in this topic because everybody I know either has it or knows somebody that has GERD, acid reflux, even sometimes when they're following what they think is a healthy plant-based diet.
I know. Well, that's one of the reasons why I wanted to do the talk.
Good. Well, I can't wait.
All right, should I go ahead and start my screen
You
share?
should.
All right, let's do it. All
All
right,
right.
let's get this started here. I'm gonna click the button and you let me know if it's working out.
Yeah, it just needs to be in a different mode.
Okay, are we good now?
Perfect.
All right, soothing the burn with Dr. Harrington. You know me, I'm a plant-based doctor, and my practice is vegan primary care, where you can see a vegan doctor online. Or if you are in Pinellas Park, Florida, the Tampa area, you can see me in person. So if you're in one of these 16 states, you can see me online as your primary care doctor. I do accept insurance, so thanks for that shout out there, Chef AJ. But today we're talking about soothing the burn. So just like you said, there are a lot of people that deal with this, and it can be really bad, and it can really affect their life. And even when you feel like you're doing everything right, there's something that might be missing. It's multifactorial. So that's one of the reasons why I want to bring this out. Also, there's been concern that people are taking the PPIs, the medications, the proton pump inhibitors for basically lifelong use, and some of the effects that might come of that. And even the GI societies recommend only taking these things for 8 weeks at a time and trying to come off. But even though those recommendations are out there, it seems like no one tries to come off of them because they have rebound and that kind of thing. So that's why we're going to talk about it today. Whammo. This is a bottom line up front slide. So, if you didn't get anything from this presentation, I want you to go vegan, go plant-based, whole food, plant-based. You're going to have the best outcomes related to your heartburn. Big factor, even if you are plant-based, you really want to focus on eating low fat, watching out for extra oil, watching out for saturated fat, because you'll learn in the presentation that these are one of the things that increases the rates of heartburn. Losing weight can help, additional pressure pushing on the stomach pushes that acid up. So that's important to try to lose weight, try to be a normal BMI if this is a factor. There are certain foods, but obviously avoid the toxic things like alcohol and tobacco. There are some things that may relax the sphincter, the esophageal sphincter close to your stomach, causing additional heartburn. And there are certain foods, and these are very individualized. Avoid eating before bed, because when you lay down and you lay flat, just mechanically, you're going to have potentially more regurgitation of the acid up into your esophagus. So avoid sleeping right before eating. Sleep on your left side. Left side is going to create the angle there on the esophagus where you'll have less reflux just mechanically, just naturally. The stomach is on the left side. So if you sleep on the right side, it's going to kind of drain right into your esophagus. Raise the head of the bed. Don't just sleep on a pillow. If you raise the head of the bed, that's going to create an angle to help drain use gravity to your benefit, to help drain the acid down. And one of the things they mention, this is kind of a no-brainer, but tight clothing can also exacerbate heartburn. So what is heartburn? What is GERD? Gastroesophageal reflux disease. This is where you have acid that's actually going up into your esophagus. Now, the esophagus has a lining that's similar to the lining of your mouth. And it has a different lining than the lining of the stomach. So the lining of the stomach has mucus that can help to block, or it can help avoid being irritated by the acid, and whereas the esophagus doesn't. So if you've ever had reflux in your mouth, you feel the etching of the irritation in the mouth. That's happening in the esophagus. So symptoms of GERD are burning in the chest, right in the middle of the chest. And so you're kind of get the diagnosis if you have this 2 times or more per week, or you're getting that kind of reflux up into the throat, regurgitation. And some people can, if they deal with this for a long time, can have kind of chronic sore throat, sort of postnasal drip that can cause a cough, unexplained cough, feeling nauseous a lot, or you can start to develop problems where you're having trouble swallowing, or you're having to kind of wash food down with water because your esophagus is irritated and swollen. These are some related symptoms. So when the esophagus gets irritated over and over again, it's called esophagitis, or irritation, inflammation of the esophagus. So here is one grading system, this Los Angeles classification. And so they're trying to grade the severity. They're also here about length of the esophagitis segment. You also hear about that segment, 3 centimeters versus 3 centimeter segment versus longer. This is another way that they'll classify esophagitis. So this is the effects. This is the effects of the acid: inflammation, irritation, burning. But what starts to happen is precancerous changes in the esophagus. So this was a really good slide showing that the lining of the esophagus changing from the almost like the oral mucosa, this thin lining, to the glandular mucosa, which is like the lining of the stomach. So you can see the two breakout images, the two circles there, showing under the microscope, it actually looks different. It looks like tissue from the stomach, but it's in the esophagus. So this types of changes that they see under the microscope, this is where the cells down by, I'm going to use kind of an analogy or a personification of these cells down by the stomach. They say, oh my gosh, I'm getting burned every day by the stomach. I think I want to be a stomach cell. So they start to kind of almost mutate and change and start to turn to look more like a stomach cell that is kind of protected by, because that's what it's designed to be. But this changes and this mutation is a setup for cancer. And so this is the dreaded concern for esophageal cancer. And this is very serious. It is really a very serious disease and carries a high mortality rate. So one of a huge risk factor for having bad esophagitis and kind of a setup for esophageal cancer is this hiatal hernia. And I just think it's good to kind of take a picture, kind of get a quick understanding of this. The stomach is right below the diaphragm. The esophagus pokes through the diaphragm and there's the stomach. And the diaphragm works as almost another sphincter, so to speak, or a way that the stomach remains separated from the esophagus because of the tight musculature. But if the stomach slips through the diaphragm, where you have part of the stomach above the diaphragm, you don't get that extra kind of grip from the diaphragm. And the lower esophageal sphincter, the separation from the esophagus to the stomach, gets distorted. And I use the analogy of a twisty like balloon animal, where if you squeeze on it, it kind of distorts the balloon animal. And in this case, it kind of distorts the sphincter and kind of opens it a little bit so that acid can creep up into the esophagus. So heartburn and GERD is very different in terms of rates. It's increasing in the United States, but the rates are different among various countries and various parts of the world. And so what we're seeing here, this is the United States. It's increasing. Way back in 2005, it was a quarter of the population had experienced some sort of GERD, and this is probably increasing. But because we know that it's very different in different countries, and we as humans are reasonably similar, that it's likely to have lifestyle factors that might be affecting it. So once again, this is from acid from the stomach going up into the esophagus. And one of the things that is the biggest factor is this lower esophageal sphincter. Okay, this is a muscular area of the esophagus right at the beginning of the stomach. And foods and different things can affect this sphincter, can relax it or keep the sphincter tone high throughout the day. So we know that as fat is being released from the stomach into the first part of the intestines will sense the nutrients there. And if it senses fat, the body will send out hormones that will relax the esophageal sphincter. So here is a pressure monitor. You can see the pressure is at a normal pressure, and then the pressure goes down. So this is a pressure monitor right inside the sphincter there. When fat is infused into the first part of the intestines, the duodenum, you'll start to see a lowering of the esophageal pressure. So what that does is it allows for things to reflux at a greater rate. So this is not good. You want to eat low fat. So what's happening there? What's happening? What's signaling? What's the body doing? Well, the body's sensing the fat, and it knows that we have to release bile to help you absorb the fat and the fatty nutrients. And so what the body does is releases a hormone called cholecystokinin. Cholecystokinin, the bile-releasing hormone, it has an effect of getting the bile to where it needs to be, but it also relaxes that esophageal sphincter and can worsen your symptoms of GERD. So they have proven this. They have proven this beyond a shadow of doubt. Here is a McDonald's McMuffin, like English muffin. Of course, it has animal products and it's high fat versus the same restaurant. So McDonald's hotcakes. Hotcakes was considered to be a lower fat meal, not healthy, but lower fat meal. So the white columns there are show the percentage of the time where it had very low pH, so acid inside the esophagus. So the higher fat meal showed a higher percentage of the time with low pH. So, but it's not just the fat. It's a multifactorial thing. So also meal size has an effect. So on the left side of the screen, you'll see meal size with a 500 mils versus 800 milliliters. And so in the 800 mil, the larger meal caused more acid to be into the esophagus. On the right side of the screen, there's another test regarding fat. So you had 500 milliliters of a low-fat food versus 500 milliliters of a high-fat food, and showing much more acid in the esophagus, lower pH at higher percentage of the time. So I call this my baker's bag analogy. If you imagine that the stomach is kind of like a baker's bag, it's holding a material and it's releasing the material little by little. The reason why it does that is the intestines, your body wants to absorb as much nutrients as possible from the food. And the way it does that, it can't handle a big bolus of food all at once. So it wants to process little by little. So the stomach is like a baker's bag, squirting little by little the amount of food into the intestines. This way, the body can get a good absorption of the food. So the problem is that the larger the meal is, it's going to take longer time for the stomach to kind of process it and get it all released into the intestines. And so the longer that it's in there, the more likely you are to have irritation in the esophagus. Okay, so I came across this. This was kind of interesting. This was about stomach emptying times, and this was done with a radioactive a tracer that was radioactive, and they did almost like a Geiger counter and a nuclear medicine test, and they watched as the food went through the system so they could determine how long the food was in the stomach versus the intestines or the colon. So how long does food actually stay in the stomach? And so what they did was they gave 10 different volunteers baked beans and mashed potatoes and sausages and custard, and they gave them this large meal, and they watched it pass through their system. And so all of those stomach tests were superimposed there on the right side. So you can see that usually by 2 to 3 hours, most of the food is out of the system, out of the stomach. It can take up to about 5 hours or sometimes longer, but most of the food is out by then. So what are some of the factors that would make GERD worse? So we've talked a lot about the lower esophageal sphincter, and we've talked about the tone from the diaphragm and whether you have a hiatal hernia or not. Another thing is that if there's acid inside the esophagus, it can be washed away by just simple salivary clearance. So things that might cause you to be parched or have dry mouth could actually increase your potential for heartburn. So that's kind of interesting. Something called motility or peristalsis. You know, the intestines kind of are always in this moving forward state, unless you're vomiting. And things that can affect motility and peristalsis have the effect of reducing GERD or making GERD worse if it slows it down. Some people, almost no matter what they do, they have a hypersensitivity and they'll experience GERD with foods that would not normally affect someone. So this is called a hypersensitivity or having irritated mucosa. There's some people who have problems with things like condiments and things that are really concentrated or very salty because it's literally locally irritating the esophagus as it's going down. Another thing, stress from poor sleep is associated with heartburn. And this is because we have two-part system. We have sympathetic and parasympathetic. So we have fight or flight or the rest and digest system. So if you're always in fight or flight, your stomach might be getting less blood flow and more likely to be irritated. So that is the parasympathetic problem. So here are some various factors that are quite obvious. Fat increases cholecystokinin, relaxing the lower esophageal sphincter. So that's one big aspect. So avoid fatty meals. Keep fat as low as possible. Smoking is known to decrease saliva, and it also relaxes lower esophageal sphincter. And alcohol can increase the acid in the stomach, and it can also slow down peristalsis. So alcohol can affect it. So, with a lifestyle medicine doctor, we're going to tell you to avoid alcohol and cigarettes, but just definitely want to put this on the slide. Okay. I said it. Number one thing that I recommended from the very top of my talk was switch to a totally whole food plant-based diet. Plant foods are protective. So you can see here that when studied, they see a much less heartburn with higher intakes of these vegetables. Total vegetables, cruciferous vegetables, 36% less, raw veggies, and leafy greens are really coming in for the win for the biggest factor in terms of foodstuffs that you can eat in terms of preventing heartburn. When it was broken down to antioxidants and various vitamins and minerals associated with the plant foods, the folks that had the highest intake, on the fourth quartile, so you break people up into normal, low, medium, and high intakes of various vegetables. The highest intake of vegetable stuff had 50% less heartburn incidence. So in the same study, though, they showed that people who were taking multivitamins and stuff didn't have any difference than there was no improvement that they could find from various vitamin supplementation on GERD. So it wasn't the vitamin C in the multivitamin, it was vitamin C associated with the foods that they were eating, that kind of thing. Here's another one versus stomach cancer. For stomach cancer, dark green leafy vegetables, the odds ratio of having stomach cancer was 0.4, so 60% less odds of getting stomach cancer with having a high intake of dark green leafy vegetables. In this case, it was only 2 servings a week compared to none. Apples, if you had 6 apples per week, their odds of having stomach cancer was 50% less. Red or orange vegetables, like such as carrots or tomatoes, only 4 servings a week, decreased it to 30 to 40% decrease. And citrus fruits, 3 to 4 per week, 20% decrease. And on the opposite thing, if you're eating animal foods, you have increased risk for esophageal cancer. This was kind of interesting that red meat increased your risk for esophageal cancer 3 times the risk, versus poultry was almost 2 times the risk for gastric cancer. And then high-fat dairy also increased the risk as well. So one of the most interesting things was that people that had Barrett's esophagus, they had changes inside the esophagus from the acid. They did a study one time where they treated it with strawberries. Now it was a lot of strawberries. So what they did was they freeze dried the strawberries and had people consume it with water so that they could get kind of a high dose of strawberries this way. Kind of remove the water so that you can give it to them almost like a medicine. And so they did freeze-dried strawberries, 60 grams per day for 6 months, and they had dramatic improvements. So 28 had 80% improvement, 28 out of the 36, and then 19 out of the 36 had cured rates, were completely cured of their Barrett's, and it was tested with when they had a scope and they had biopsies. And this picture here shows tissue above is inflamed and it has proliferation of additional cells like precancerous type cells and much more calm or cool type tissue, much more uniform tissue below. So this is the before and after. So quite impressive. So here's one of the things. I mean, people are different. People are different. So here's my little picture: square peg in a round hole. This is not a one size fits all thing, where some people tend to do better with or worse with coffee, or worse with chocolate or peppermint. But the foods, basically, if the food flares up your heartburn, you should try to avoid it. First thing I tell people is, like with tomatoes and tomato sauce, is it the tomato sauce, or is it just that because you're eating a very large meal and your stomach is really full? Maybe the pasta has olive oil and it's really fatty. So, I mean, you're eating a fatty meal that's really large, and oh, by the way, it has tomato sauce. Is it the tomato sauce that implicated or not? You may have to test that. But tomatoes themselves, when tested, are not particularly bad. But it seems to be one that has drawn attention: tomatoes and citrus. But the ones that are starred here, fatty foods, chocolate, alcohol, and peppermint, are actually proven to decrease the tone of the lower esophageal sphincter. These other things are reported, but everyone has a different sort of response. And so that's why this is a multifactorial disease, and some people may do fine with citrus, but others may not. Processed food, some people, if you're eating sort of bread versus a whole grain, that they will experience worse GERD. And this might be the relationship with the fiber aspect, kind of reducing the liquidity of the chyme of the stomach, the bolus of the food, making it more of like a sludge, that higher fiber, soluble fiber. It has a potential to reduce heartburn. And so multifactorial. Okay. The treatment for heartburn is mostly over the counter. So we have antacids like Tums and Maalox. We have histamine blockers like Pepcid or Tagamet. And then you have the PPIs, proton pump inhibitors, which is kind of the gold standard, omeprazole or esomeprazole. But as we started off saying, there is concerns about long-term use of PPIs. And the biggest risk is the fact that you're twice as likely to come down with something called C. difficile in relationship to antibiotic use. So this is an enteric infection that people will get after taking antibiotics, and it wipes out a lot of their microbiome. And one of the bacteria, Clostridium difficile, will overgrow and create a toxin that will irritate your bowels. And some people have, it's very serious, and people can have life-threatening complications. So this is a concern, 2 times the risk. There's concerns for osteoporosis due to calcium absorption. And the latest I got from, this is from the GI.org, from the Gastroenterology Society, US Gastroenterology Society's information regarding osteoporosis. They say, oh, the latest is slightly protective, 0.4, but there are many other studies that say that it could potentially worsen osteoporosis. And so I'm just putting up what the latest I have. So pneumonia, the odds a 2% increase. Let's see, 1.02. Dementia, 1.2. Lifelong PPI use increases dementia rates by 20%. So that's pretty concerning. Kidney problems, something called acute interstitial nephritis, is 17% more. All-cause mortality, death from all causes, 3% higher. And there's also nutrition deficiencies that are concerns with these things like magnesium and obviously B12. That's a big concern for vegans. However, the GI Society recommends lifelong therapy, that the risk of Barrett's esophagus and esophageal cancer is higher than these other diseases. And so they're still recommending lifelong proton pump inhibitor therapy if you've had a severe GI bleed, if you have to take ongoing NSAID use that might irritate the stomach, causing GI bleeding, which could be life-threatening, Barrett's esophagus, severe esophagitis. Dual antiplatelet therapy is therapy that is, if you have a stent plus you've had a stroke or some kind of problem where you're required to be on aspirin plus something called Plavix. This puts you at a higher rate for gastrointestinal bleeding, so they recommend PPI use. Hypersecretory conditions, this is where people have gastric hormones that are causing higher levels of acid, so you're trying to combat it with acid blockers. So if this is not you, you should try to come off of your PPIs, even if you've been on it for a year or 2 years or 3 years. This is a great site called this Deprescribing.org. Deprescribing.org is a Canadian site. And so it's pretty cool. They're basically telling you, hey, focus on your lifestyle factors and come off those PPIs. Come off. If you want to, you can try weaning down. If you're taking them twice a day, go once a day. Cutting the dose in half, stopping and then using a different class of medication like the TUMS, the antacids, or the H2 blockers to be used as needed to try to get you through. Now, when you first stop, there's going to be after about 2 or 3 days, you're going to have a rebound of acid. So it's going to be kind of a rough week to 2 weeks that you could use alternate therapies and be real super careful with fat and avoiding, going to bed right after eating, that kind of thing. So there are other therapies other than these antacids that we described. There's medicine that's oftentimes used in pregnancy, something called sucralfate, which tries to line the GI tract, and it's not really absorbed, so it just kind of lines and coats the GI tract to help with esophagitis and that kind of thing. There's motility agents. These are not that great, but they try to kind of cause the peristalsis. They try to improve peristalsis so you can kind of move things along and get the acid out of there. They are marginally effective, but sometimes worth a try. Acupuncture has been studied, and in small studies shows a benefit. And I really think this is related closely to the vagal nerve aspects, stress reduction, getting good sleep, and things like ulcers are kind of anecdotally associated with people who are super stressed all the time. That's because of the lack of blood flow to the stomach. I know heartburn and ulcers are different, but same kind of benefit that you would get from relaxation techniques, mindfulness, meditation, these kind of therapies. So there are things that you hear about, like alternative therapies, like apple cider vinegar, for instance. Apple cider vinegar, and this one's kind of never made sense to me because it's an acid, acetic acid is acid. And so, but some people claim, they drink it with a straw. You don't want to be, dilute it and drink it with straw and in the back of the mouth and swallow. But some people swear by this, but I don't know why theoretically this should work. if it is a higher pH than your stomach pH, which potentially it is, it could be in a way kind of almost like buffering it. But some people suggest that apple cider vinegar should slow down gastric emptying, which has a blood sugar benefit. But in the end, that might cause in theory, a heartburn worsening. So apple cider vinegar has been touted, but I'm not sure. I've understand why that works, and I've had mixed reviews basically when people take it. So, okay. Overall, to soothe the burn, I recommend that you go plant-based and you eat a very low-fat, high-fiber diet. Take those trials off of PPIs and go to deprescribing.org if you want more information on getting off PPIs. And talk to your doctor about coming off, and that you want to be deprescribed off PPIs if that's possible. And if that doesn't work, you can talk to me, get a doctor who gets you. As a vegan doctor, Dr. Scott Harrington, you can see me online in these 16 different states, and I take insurance. Also, you can see me for cash if needed, $250 for a 1 hour or $125 for a 30-minute. And there we go. I'm ready for your questions.
Thank you, Dr. Harrington. A few people were commenting in the chat. So you're saying that GERD can actually lead to cancer?
Absolutely.
Yeah.
Absolutely. My analogy for this is the sun and the skin causing skin cancer. Okay. Whereas you use the analogy as the sun versus the acid causing damage. And my little story about if I was a esophageal cell and I was getting burned every day, I would say, oh my gosh, I wish I was a stomach cell. And I want to mutate and turn into a stomach cell. And so if I was a skin cell and I was getting burned by the sun all the time, I would say, oh man, I wish I had a big melanocyte, so I could, like an umbrella to protect myself. So in the end, these cells that get irritated mutate over time, and they can turn into precancerous lesions. And then if it gets worse and worse and worse, cancer. And that's the reason why PPIs are so prevalent, and people go see their GI doctor and they get scoped to get monitored for this kind of thing. It's called an EGD, esophageal gastroduodenoscopy. So yeah, it's no fun having to do that.
Is that like an endoscopy?
Yes.
I had one and I refused the anesthesia. Boy, that wasn't fun.
Oh my God, are you Rambo or something?
I am Rambo. I mean, I couldn't believe it. I'm more afraid of being sedated than I am. But they said I was only the second person in the history of the hospital that ever do that. But yeah, it wasn't fun, I will tell you. But I'm so afraid of, sedation of any kind. So what can I tell you?
Quite impressive. I mean, the Army needs you, Chef
I know.
AJ.
I was just thinking maybe I'm military material. Having a colonoscopy though without sedation is not hard at all. Not if you have a good doctor that does the water method, and it's actually fun to watch.
Yeah. Well, I mean, they want you to be sort of awake so that you can tell the doctor if you're in pain, because that can reduce the rates of perforation.
Yeah. But it's fun. All right. So let's get to the questions. The ones that were submitted in advance were not on this topic because sometimes they do that. What I found interesting, I'm going to have to watch this again, but in your slides, you had peppermint is one of the things that could be not so great, but it always seems to give you peppermint when you have nausea or things like that,
Yeah. Well, I mean, it's supposed to be associated with lowering the lower esophageal sphincter tone. And so I always joke around that if you want to have someone to have heartburn, you go and you eat a big meal of pasta that swells in your stomach, and that's cooked in olive oil, so it's fatty, and with some tomato sauce, and then drink some coffee and a peppermint on top. And you'll have some heartburn for you, and then go straight to sleep. That's the perfect storm. The perfect storm for heartburn.
Do you think it's good though that some of these medications that used to be by prescription only are just, because people can just, even if their doctor doesn't give them Ozempiral or whatever it's called, they can basically get it in a you can take a lower dose and take more. So these medicines have been available without prescription for some time now.
Yeah, overall, they're very safe in terms of, and when people are experiencing really bad heartburn, I would rather someone be treated until they kind of get it under control what they're doing. Because once again, just you don't want someone to have burning and burning and burning and burning. Over time, it's problematic for the esophageal health. So I'm glad that it's accessible. And so pregnancy is a big thing too. I mean, like for instance, I think something like 50 or 60% of all pregnant women at some point in their pregnancy will experience really bad heartburn. And so having access to various therapies is great.
Can losing weight sometimes help, even if they're eating a good diet? Like does it get better if sometimes people lose weight?
Dramatically, yeah, dramatic improvements with normal BMI. Yeah, every decrease, because you have two factors there. You have the intra-abdominal pressure, so you have visceral fat causing, crowding the abdominal cavity. So you have that. Plus, the visceral fat creates an inflammatory situation that kind of makes it worse as well. So it's multifactorial.
Great. Well, thank you. Actually, one of the questions submitted in advance is on this topic, and this is from Caroline. And sorry, wrong one. Nope, it's not from Caroline, and it's not on topic. I'm reading the wrong thing. This is from Tamra, and it is not on topic, but hey, it's a good one. So we'll give it to you, then we'll get back on topic. And it's after birthing 10 children, I decided to have a consultation on having a tummy tuck with skin removal. The surgeon said that I should eat 3 times the amount of protein that I would normally eat. She said, based on my weight, which is 140 pounds, I would need to eat about 196 grams of protein post-op. What would your recommendation on how to accomplish this in the most effective way? And first of all, is that even true?
Well, a lot of times you'll get this from weight loss surgeons and surgeons in general, because they're focused on healing and they want there to be, a high amount of protein. But in general, this is not a healthy way to eat. My thought is that if they're trying to like crowd out fat and these kind of things by eating so much protein, but you're stressing your kidneys. So you want to eat 0.8 grams per kilogram of healthy body weight. So you can use an ideal body weight calculator. It's a kind of a pharmacy tool to weight-based dosing for certain medications, because you don't want to dose it based on your fat. You want to dose it based on your lean body mass. So I think it's like 100, and maybe you get 100 pounds for female on this calculation, and then you get 5 pounds for every inch taller than 5 feet. So if you're 5'4", it's 120. And then you calculate your protein requirement based on that weight, an estimation, a Kentucky windage for your lean body mass. Then you calculate your protein requirement. And so that's 0.8 grams per kilogram. So in that instance, maybe it's 60 kilograms. And then you multiply that by 0.8. So I don't know, maybe that's 54, 52, something like that. So that's way different. That's like 4 times less than what this doctor is recommending. And so, I mean, people who are trying to do this, like loading with protein and they're on the plant-based diet, a lot of times, I mean, if you just want an experiment, you want to try this, what you do is you get these blocks of tofu. You eat multiple blocks of tofu along with the rest of your plant-based diet. And you can really start getting up into these high numbers. But that's kind of ridiculously high.
It doesn't sound very appetizing to just be eating blocks of tofu.
Right. And so you can see that it just seems ridiculous, and that's because it is.
Yeah, thank you. Okay, so this is a question from Brown Eyes girl. If a person has a hiatal hernia with plant-based diet, weight loss, etc., what effect will this have on the hiatal hernia?
Well, I think that this may have a bit beneficial effect because the intra-abdominal pressure goes down, and so there's less of kind of pushing the stomach into the chest cavity. However, this is one of the things where bad things can happen to good people. You know, you do everything you can. You try to, but we have specialists and everything that can come to the rescue on this. If you have really bad hiatal hernia and you have persistent, this is the case where you can try to do everything right and you can have persistent heartburn because of the changes of the anatomy and the lower esophageal sphincter being kind of misshapen and not getting a good seal, so to speak. And so even if you do everything right, this is the case where people actually have surgery to reduce the hiatal hernia and fundoplications and these kind of things. Now, I'm a minimalist and I'm not usually kind of pushing these types of therapies. But for instance, if you had signs and symptoms of worsening GERD, no matter what you did, and you're eating the right diet and you're doing everything right, you may have to cross this bridge. You may have to treat yourself so that, just mechanically, you could have a better situation. But certainly I applaud everything you're doing. Weight loss and the healthy lifestyle, you're going to have a much better improvement. But you never kind of leave that option out if things aren't getting better. Chef AJ, I can't hear you right now.
I don't know how I got muted, so thank you. Okay. The question is, I suffered from chronic severe heartburn for many years, but it completely resolved after going whole food plant-based 6 years ago. In preparation for a future pregnancy, I had started taking prenatal vitamins, the Ritual brand, and soon after I developed severe chronic heartburn. After some research, I concluded it was the iron in the prenatal, so I stopped taking them and the heartburn gradually disappeared. Upon starting the same prenatals a few months ago, the heartburn immediately returned, so I stopped taking them and the heartburn resolved. I'm willing to try another brand of prenatals, but I'm afraid of the potential debilitating heartburn. Does the type of iron supplement or brand make a difference? Is it unsafe to avoid iron supplementation during pregnancy?
No, it's not unsafe at all. The key is if you are actually anemic, you want to have the best situation going forward. So simply get tested, make sure you're not anemic. So you would test your complete blood count, and that would check your hemoglobin. And then another test for iron status is ferritin, which is your iron storage molecule. And so let's say this is 19, 20 or above, and you are not anemic, then you wouldn't necessarily have to supplement. Some of the big things that they are concerned about with multivitamin and supplementation for pregnancy is folate. So that's kind of the main concerning component. But there's also, they've talked about DHA and omega-3s. There's some concern about choline, for vegans. I'm not 100% sure on that evidence, but that is one of the things that is nationally recommended. So, but you have basically done your own experiment. You found that that the iron is causing a problem, and so I have to commend you. This is amazing. What you have to know, though, is that iron, now the gold standard way that people are taking iron is every other day dosing. Every other day dosing. So if you are taking a multi that has a high amount of iron in it, it might be irritating you. Look for one that doesn't contain iron, and you could, if you needed iron, take it with the gold standard treatment, which is every other day. The pills, the standard like over-the-counter pills are 325 with a 65 milligram of elemental iron. So that's the standard dose. So that's kind of a high dose and may cause constipation and slow down the peristalsis. And you could do it more of the lower dose, like Solgar's gentle iron, which is only 20. Things like that. Mega Blood Builder, that's something like 20. Some of the brands like that. So more of the gentle iron is just a lower dosing. So you could try that. So that's a place to start.
Great. Thank you. Lydia wants to know if you can see patients in Canada.
I can, but it's kind of more of a coaching situation. So I can go worldwide. I can see it, but I'm not licensed to prescribe medications in Canada. So it would just be a coaching and advice, that kind of thing.
Got it.
And kind of goes for any state. You know, I would not be doctoring you. I would be coaching you and can provide you advice about plant-based diet and that kind of thing.
Makes sense. Thanks. Okay, here's Florence would like to know, why do I get heartburn when I eat whole food, plant-based homemade soups or just drinking water? Is it because I have these on an empty stomach?
I've heard people say, water, anything kind of irritates them. And I worry that patients like this are dealing with a hypersensitivity. And so one of the things soup should be really well tolerated in general, especially if you have a soup that's not creamy. If you have some, creamy soups with coconut, like some of those butternut squash soups that have like coconut and stuff in them to make them creamy, that could be concerning, like a fat intake. But if you're having a low fat minestrone type soup, it should be really well tolerated. So yeah, then there could be some spice. There could be some something that might be irritating you literally as it's going down. That could be a concern. One of the things to watch out for is like just going to bed, if you're eating it at night right before bed and then experiencing the heartburn that way, maybe it's just the fact that it's related to the timing. So those are some of the things to look out for. If there's a sort of the option, I wonder too sometimes if the idea of a fast, if you are dealing with esophagitis, low-grade esophagitis or esophageal irritation, if going through short-term fasts maybe give your esophagus a break, basically. That's if it's more than 3 days, I recommend it to be monitored, definitely.
Great. Thank you. I'm hopping over to Instagram. Instagram, the reason you can't see slides is because this is a YouTube show. So that's the best place to watch. And that's also where the recording is. And the question is, it was about Barrett's esophagus. It was from Jan. How do you get off PPI with nighttime reflux caused by Barrett esophagus?
So if you have Barrett's esophagus, confirmed by GI doctor doing an endoscopy, and they've done biopsies and everything. The current recommendation is for you to continue antacid medications, and the recommendation is lifelong. So this kind of doesn't sit well with me, the idea like, oh my gosh, someone is having to take lifelong therapy. But that is because right now the PPIs are the therapy that has the most evidence in preventing progression of Barrett's esophagus. And so if you wanted to basically go off that treatment, you would be outside of the gold standard medical advice. So I guess, one of the things that I kind of think about this is if you have silent heartburn, if you don't know that it's happening, and they test and you still have Barrett's esophagus, that is like really concerning because there's no way for you to know that it's happening. And so you're sort of relying on the surveillance aspect with the endoscopy. But if you can tell and you're very obvious when you're having heartburn or not, then you could sort of go off script, I guess, and do sort of frequent surveillance, trying to come off the medicine and only going back on if you had symptoms. However, this is not the gold standard. That's not necessarily recommended. The recommended for the American Gastroenterology Society is to stay on this antacid medications if you have Barrett's.
Thank you. And somebody on Instagram is also saying, can you please repeat what you said about freeze-dried strawberries?
Yeah, this is so cool. So the paper is available. They had done a cancer treatment trial, a placebo-controlled trial with freeze-dried strawberries. And Dr. Greger has a video about this. So you could type in Barrett's and strawberries and nutritionfacts.org. And, he goes over and explains it. But they actually reduced, they had, they followed people up for 6 months. They had a high dose and a low dose treatment option, which was 60 grams versus 30 grams of freeze-dried strawberries. The reason why they did freeze-dries was they were able to give people the product, and it was a very standardized type of product. I see, I can pull it up. It's called randomized phase 2 trial of standardized, I'm pulling it up, standardized phase 2 trial of lyophilized strawberries in patients with dysplastic precancerous lesions of the esophagus, 2011. So,
Nice. Thank you. I actually think I have some in my pantry, so I will check them out. Okay, here is a question for you. Okay, this is interesting. Should packaged greens be avoided since they go through a chlorine bath and are then rinsed twice? Can chlorine be a problem with long-term GERD and flare-ups?
well, I mean, chlorine, I'm not advocating, willingly in taking chlorine, but honestly, chlorine is used in most water treatment. So, I mean, and then sometimes with these greens, you can have like these sprout breaks and outbreaks related to fertilizing and runoff from other fields. So I think this is a good situation where you're having double washed, and clearly it's fit for consumption. I guess what I could say is that my assumption here is that that there might be chlorine in the water, but that is probably beneficial for you and to reduce pathogens that you could potentially get on the greens. And so I would wash them when you get home and before you eat them, but I wouldn't consider this necessarily a bad thing.
Okay, cool. And let's see what else we got. They just keep coming and coming, the questions. All right.
All right, bring them in.
Okay, and tell me when you have to go, because I mean, they'll keep coming. Lydia says I was plant-based and had esophagitis. I couldn't eat anything for many months and down to 94 pounds. I'm on pantoprazole. Sorry if I mispronounced it. I'm so scared it'll come back.
Right. Well, you're on the gold standard therapy. Pantoprazole is one of the PPIs that is not over the counter, so it's a prescription. And so, if this patient had experienced heartburn, so that you have a good handle on it, then that's a good thing. So you can kind of sort of be your own self-monitor. So you're taking the medicine, and you're avoiding any heartburn, and you're eating in a way to try to avoid further irritation of the esophagus. And so keep up with those lifestyle factors, keep a normal weight. The other thing is the idea of the wedge in the bed. Somebody does, if you have a hospital bed, you can literally, put it up, but they'll actually recommend where you put a wedge, or some people will take a brick or some sort of just space occupying thing that will raise up the bed, the head of the bed, the legs on the head of the bed. You can raise it up a little bit so that in general that you're angled a little bit. So do all these things that we discussed, the lifestyle interventions, and then you could add maybe acupuncture, or you could add those parasympathetic, relaxation techniques. Those are all lifestyle medicine things. And get the serial monitoring with the EGD, so you can tell if you're having worsening. And so I'm glad you caught it. I'm glad you caught it and you're watching it. So it's not as common as colon cancer, but it's still a potentially deadly cancer. And so you want to kind of stop it in its tracks.
Thank you. And this is an interesting question because they're saying Okay, so it's about a cough. And she says, Catherine, I've had a cough about 10 years, been to several doctors, none have found the reason. What should I do? The cough is getting worse. Seems to be nothing that can be done. Wonder where
Yes.
they live. I wonder where they live because sometimes moving can help.
Chronic cough is so hard, is so hard. And so I imagine that by now she has had the full workup, which is so you want to deal with allergic things. So is this postnasal drip related to environmental allergies like molds uh, and pollen and this kind of thing, or household things like dust mites? So you can get allergy testing and find out if that is a problem. You can also try antihistamines to see if you have any benefit with your cough. And so I assume that by now she has tried those types of treatments. So then the next thing is it asthma? Is it asthma? You can get a pulmonary function test to rule out whether you have asthma. And sometimes they'll give you a medication to induce an asthma attack, methylcholine challenge. And so you can kind of rule this out beyond a shadow of a doubt by seeing a pulmonologist. So those are kind of the two sort of classic things. And then sort of the hidden aspect is the idea of extra esophageal symptoms of heartburn. And this is where at night you have little bits of acid come up and get into the airway. And then it can cause you to have an airway that's irritated, and it can increase you to have a cough. So the work up there may be related to having a scope, and also they have this pH monitoring that can be done. And this sounds scary, but actually I think it's a real thin probe that they put down there and can tell whether you're having reflux. So the fourth specialist is the ear, nose, and throat doctor. The ear, nose, and throat doctor can take a tiny scope and look in there up into your vocal cords and around your airway and upper airway, and can see if you're having laryngeal reflux. So this is kind of the workup. Now, if you've had it for, say, 5-10 years, you may have been through each one of these specialists. If not, you should check that off, because a chronic cough is a hideous way to live. It's hard dealing with it. I really feel for you. And so if you've been through all these things, then the next sort of thought is there are different medications, and sometimes you can see like neurology. They'll try various things to work on it. So I think that's probably a complex scenario, and I assume that you've tried all these lifestyle factors that we've mentioned already. But that's kind of the workup for this chronic cough.
Perfect. On Instagram, they're saying, are there some spices we should avoid?
Honestly, with they say spicy food, and they kind of give you this broad brushstroke, spicy foods, and the evidence is not there. It's all sort of anecdotal. They'll say, oh, spicy food. My assumption is that, once again, that these spices is not the cause. It just happens to be an innocent bystander that you might be eating, that the spices might encourage you to eat like a big meal. And it's the fact that you eat a big meal that might be fatty, and it's at night, you've had a big feast, you go to bed and you have heartburn. So I think these spices might be innocent bystanders, so to speak. Well, hello.
Well, we are gonna have to end soon because she knows it's lunchtime and she's like, why haven't you given me any food? Isn't she pretty, Dr. Harrington?
Oh, she's beautiful.
I just love her. Anyway, so this is somebody's asking, would a liver cleanse help with GERD? But I know Dr. Clapper's done a thing about how he feels like liver and gallbladder cleanses are fraudulent and dangerous, actually.
Yeah, I don't recommend that. I don't recommend that, because usually they'll have people drink like large amounts of olive oil on an empty stomach, and it's not good for you. Yeah.
Oh. Can a wedge pillow help as well as blocks for sleeping? Except the only thing is you go like this in bed.
Yeah, in the guidelines, they say not a pillow, use the put it underneath the bed. Yeah. So they recommend not just
You know what helped me? I broke my back 42 years ago, and now I'm like starting to feel it. And using a wedge pillow for putting my legs up has helped tremendously with chronic low back pain.
There you go. Yeah, that helps. More of a
Yeah.
fetal position with the legs to take
Yeah.
some pressure off the lower back.
Nice. Well, it's so fun talking to you. You're so knowledgeable.
Well, thank you so much, Chef AJ. Thanks for having me on. I really appreciate it.
Oh, no, I love it. Are there any topics you haven't covered? I know you've taught in glucose monitors and weight loss. And hey, did you cover cancer yet?
I haven't covered cancer in general. No. So
Only if you have good news about it. Oh, that's funny. Well, thank you so much, Dr. Harrington. If you want a vegan doctor, like a good one, like Dr. Harrington, who takes 4 different insurances and can even see you outside of the United States as a coach and even in person in parts, well, actually anywhere in Florida, if you go to him, check him out because people are telling me he's the best. And when I get Medicare in another 40 weeks, I think I'll go to him too.
Awesome. Awesome. Thanks again, Chef AJ.
Thank you, Dr. Harrington, and thanks all of you for watching another episode of Chef AJ Live. The show is a little bit later tomorrow at 1 p.m. Pacific time from the vegan kitchenista, Chef Kelly Williamson. She's going to be making Mother's Day brunch. Thanks for watching so much. If you like what you see, maybe subscribe and even give me a thumbs